interesting topic. So what most patients will come in and say is, Doc, I've had laser treatment, it's for problem X. And the first thing that I say to patients is not all lasers are created equal. Every laser is completely different and has a different target. So there are some lasers specifically targeted for pigment problems, some lasers that specifically target redness or vascular problems, other lasers that are deliberately designed to rejuvenate the skin and increase luminosity and brightness within the skin. So not all lasers are exactly the same. And I guess the most important thing to understand is, for me, it's a little bit like a car. So the kind of make of the laser, the manufacturing company, where it was made, the parts in it, actually are critical to the success of the laser treatment, but also the person that's providing the treatment is critical as well, because particularly in Victoria, there's no firm legislation on who can actually operate a laser. So you might have a person that's providing laser to someone that really doesn't have appropriate medical training, but you can get people who are very highly trained in the use of lasers and have an undergraduate degree in dermal sciences, dermatology, etc., who really can understand the structure and function of the skin and better tailor the treatments to your specific problem. Lasers in and of itself is a big topic, so we'd probably have to break it down into their individual types of lasers and what they can target, but needless to say that they can be very effective treatments for some kinds of pigment problems. For example, things like hoaries nevus, freckles are a good example of this, but often patients will jump to having laser for something like melasma, which is one of the most common causes of pigmentation, and this can be potentially disastrous and make melasma irreversibly worse. So I think consulting with a dermatologist prior to undertaking treatment is really critical, and trying to get to a centre where you've got the collaborative approach of both dermatologists, patients, and those who would be operating the laser, hopefully someone with a high enough skill that they can combine their expertise and really provide a safe and effective treatment.